Welcome, everyone, and thank you for joining us this afternoon. My name is Tabitha Walton. I'm a licensed clinical social worker and family consultant at the Caregiver Resource Center of Orange County. Since 1988, the Caregiver Resource Center of Orange County has been a trusted partner for Orange County families who are coping with the physical, emotional, and financial responsibilities of caregiving. By providing families with individualized supportive services, the Caregiver Resource Center stands apart as the only Orange County agency focused exclusively on the needs of caregivers who are coping with a loved one's chronic illness. The Caregiver Resource Center provides family consultation, support groups, assessment and care planning, counseling, respite planning, and community education. Here at the Caregiver Resource Center, we host a live stream each month. You've joined us this afternoon for What is Dementia and What is UCI Mind? Today, I am joined by Dr. Christian Salazar, who serves as an associate researcher with the UC Irvine Institute for Memory Impairments and Neurological Disorders. Thank you so much for joining us, Dr. Salazar. I'd like to give you the chance to introduce yourself before we jump into questions.
Well, thank you so much, Tabitha, for that wonderful introduction. I am very happy to be here. My name is Christian, and I am my training is as an epidemiologist. So I study the causes and the distribution of Alzheimer's disease in populations. I focus a lot of my work on vulnerable populations, looking specifically at Hispanic and Latino communities. My specific interest really is to also find interventions or find ways to mitigate the burden of Alzheimer's disease and related dementias in these populations.
Mm. That's wonderful. Thank you so much for sharing, and thank you for your work for the community and for vulnerable populations. Audience, we're going to jump into questions. And if you've joined us on Facebook or YouTube, please feel free to ask questions or share comments with us throughout the live stream. We will be checking those and we will be asking Chris those questions. Chris, let's just start off with the question, what is dementia?
Well, dementia is a general term. It's an umbrella term for a decline in mental ability that is severe enough that it can affect day-to-day functioning. And it's not a specific disease, but it's a set of symptoms. You can think of it as a set of symptoms that that can affect memory. It could affect thinking ability, and it could also affect social abilities. So, for example, someone who perhaps cooked or loved to cook for all of their lives, all of a sudden they may find themselves, leaving the oven on all the time. So that is an example of something that could be dementia. Another example could be someone who had who was good with finances and took care of all the finances for a household. All of a sudden, found him or herself not able to pay bills, or the bills piling up over time. So that's another example. And as you can see, dementia can affect a person's ability to carry out these day-to-day activities. Now, it's also important to note that there are many medical problems that can cause these dementia symptoms, and many of which are treatable or reversible, like vitamin deficiencies, hormone imbalances, or even depression. And that's why it's important to see a doctor if you notice these symptoms, as early diagnosis and treatment can make a big difference.
Got it. Thank you. So what I'm hearing is that dementia is more of the symptoms, like the cluster of symptoms, versus the actual name of the disease itself.
Exactly. Yeah. And as I said, there are many causes for these symptoms to appear. The neurological disorders, which I'll talk about in a moment, is one group of conditions that can lead to dementia, but there are also others that need to
Mm,
be ruled out that may not be neurologically oriented, that could be treated and need to be ruled out before one can say that it's due to a neurological disorder.
So having the appropriate assessment process to kind of go through that elimination of what is causing these symptoms is really important. So getting in to
Exactly.
see a doctor and a specialist is really critical um, once families start noticing changes.
That's right. That's right. And once someone notices these memory or thinking problems, and especially if it starts to impact someone's ability to live day to day, that then
Mm,
would require a clinician to assess and rule out these other conditions that might not be related to anything neurological.
mm. Well, we'll come back to that a little bit more later on about how to get diagnosed, why is it important to have a diagnosis? But a big question that we get here often from family caregivers is what is the difference or similarity between dementia and Alzheimer's?
Yeah, that's a good question, and that's something that we get as well as a very common question. Um, as I mentioned, dementia is this umbrella term for a range of symptoms related to memory loss and thinking problems. Alzheimer's disease is the most common neurological cause of dementia. And it explains about 60 to 80% of all dementia cases. So when we talk about Alzheimer's disease, what we really are looking at is a specific protein, right? That toxic protein called beta amyloid that clumps together and forms plaques, what we call amyloid plaques, that can accumulate in the brain. And then there's another protein that is called tau that clumps up and forms kind of these tangles inside of the nerve cells. And both of these maladies, both of these conditions, the plaques and the tangles, create a situation where the communication between parts of the brain get diminished, and in fact, the nerve cells themselves begin to die. So over
Mm,
time, you can even see it in a brain image. Over time, the brain begins to shrink because of the
mm,
plaques and the tangles. That is the
mhm,
hallmark of Alzheimer's disease.
mm,
So in essence, not all of dementia is caused by Alzheimer's, but all of Alzheimer's can lead to dementia and leads specifically
mm.
to dementia.
I think that's a really important distinction to know. Alzheimer's is a disease process which can cause dementia.
Exactly.
Okay. What are some other, maybe the most common types of diseases that would cause dementia?
Yeah, so if we're talking about the neurological disorders, as I said, Alzheimer's disease is one neurological disorder that can cause these dementia symptoms. Another one is something called vascular dementia, and it's caused by the narrowing of the blood vessels that lead to the brain and cut off they get narrow. It cuts off the oxygen and all the nutrients that the brain needs to function. And when that happens, you have the nerve cells dying off, and that can be a problem. And it's usually seen in individuals who have, for example, have had a stroke. You get these lasting symptoms, and that can lead to something called vascular dementia. Um,
Mm,
there is another condition called Lewy body dementia, which are other kinds of proteins that also clump up in the brain and can cause visual hallucinations. It can cause movement
Mm,
problems. And that's the essence of Lewy body disease or Lewy body dementia, and can cause these symptoms of
mm,
dementia. Another condition is frontotemporal dementia, which affects the frontal lobe and the temporal lobe of the brains. And that condition can affect personality and behavior in individuals with the disease, and can lead to these symptoms of dementia as well. We also
mm,
have Parkinson's disease dementia, individuals who are diagnosed with Parkinson's disease, which is primarily a movement disorder. Um,
mm,
After the diagnosis, after the symptoms of the movement problems begin, you have also these symptoms of dementia that can occur about a
mm,
year or so after the symptoms. So that those are the conditions that also cause dementia symptoms, but they occur less frequently than Alzheimer's disease.
mm. And you said Alzheimer's disease is the occurrence is about 60 to 80% of all neurological based dementia cases. So that's a very significant number. Yeah.
Right, right, and there, a lot of the research, a lot of the work right now that aims to lower the prevalence of dementia is specifically geared towards Alzheimer's disease, because it is the most frequent disease, most frequent condition, neurological condition that can lead to dementia.
Mm, mm. That's really helpful. So how does dementia get diagnosed?
That's a good question. So the diagnosis of dementia is very can involve a lot of things, and it usually is a combination of medical history, physical exams. Again, the clinicians need to rule out these other conditions that can mimic these symptoms of dementia. Um, so it involves a lot of physical exams, of blood tests, laboratory tests, and specifically brain imaging, because what we want to do is we want to look at the brain and see whether or not we have evidence of shrinkage of the brain, and also whether
Mm,
or not there's evidence of amyloid plaques accumulating in the brain. And we have the technology, the brain imaging technology, to actually look at that. Um,
mm,
and
mhm,
doctors also use cognitive tests to assess memory, problem solving, and other thinking skills. And typically, these tests are very comprehensive, so they require a lot of hours of testing to
mm,
figure out, what areas of functioning are affected
mm,
by the dementia. And
mm,
this process helps to rule out other causes and determine, if the symptoms are due to dementia.
mhm. So yeah, so what you're describing is that there is a multi-step process to getting an actual dementia diagnosis, and it involves brain scans, medical background, like there's multiple steps that have to happen to really get a confirmed diagnosis. And I think that's important for
That's
families to
correct.
hear because I think there's a fear of, going into the doctor and you're going to get this very serious diagnosis, just kind of slapped on you. The reality is that it sounds like it takes time and really a specialist discerning, what is actually going on. Um,
Yeah,
and you mentioned
exactly.
other causes of dementia. So I'm curious, what are the other non-neurological causes that might cause dementia symptoms?
Well, as I mentioned, there are these other conditions like vitamin deficiency. It could be, a thyroid problem that can cause just symptoms that mimic dementia, or can even be, related to memory problems. Another example is depression. You know, a lot of people can be depressed and just have these memory symptoms that occur when the
Mm,
disease is very manifest in a severe kind of a uh, format, and it's very difficult to know for sure. That's why
mm,
it's important to get tested and to rule out these other conditions before
mm,
we start looking at some neurological causes of the dementia.
mm. Yeah, absolutely. My next question was going to be, why is it important to have a diagnosis? But I think you just answered that. But is there anything else that you would want to add to why it's important for people to seek out a diagnosis?
Yeah, it's very important, and as soon as you um, are aware of any symptoms that I just described, it's very important for people to know and understand what's happening. And it's important because we want to plan for the future.
Mm,
It's important to know what kind of treatments are available. There are some treatments for early stage dementia, some treatments that can help mitigate some of the symptoms of early stage dementia. There's also support groups that you can join especially for caregivers that may be in there, learning about how to care for someone with dementia. Those things are important, so it can connect you with resources. Knowing about a diagnosis can connect you with resources early on in the process,
mm,
and can help hopefully improve the quality of life of not just the person with the dementia, but also the caregiver. Um, Early diagnosis can give you more time to manage symptoms and
mm,
make important decisions that you'll need to make with the
mm,
diagnosis.
mm. Thank you for that. With that, uh, what are some of the risk factors that someone might have for dementia?
So whenever we think about risk factors, I always think about them in two broad categories. You have, on the one hand, you have what I would call the non-modifiable risk factors. So these are
Mm,
factors that we can't do anything about, we can't control.
mm,
For example, age. We know that age is a
mm,
risk factor for dementia. In other words, um, we have evidence that for every 5 years after turning 65, your risk of dementia doubles. And
mm,
um, and that's not to say though that everyone who gets older will get dementia, but rather, and the proof of that is that we have very healthy, cognitively healthy 90-year-olds and 95-year-olds
mm,
and
mhm,
over. And so it doesn't mean that you will get a dementia if you reach those older ages. It just means that you have a higher risk of developing dementia.
mm,
Another risk factor that is non-modifiable is genetic risks. What we know of certain genes, like 20 genes that we've identified that can increase your risk for dementia. We know that these genes are there, and we know that if you have these genes, that they could increase your risk. Um, but again, just like with age, it doesn't necessarily mean that you will get the disease if you have these risk factors, these genetic risk
mm,
factors. The most common of which is, of course, ApoE, which I won't go into, but it's a very common type, common genetic risk factor for the disease. Um, and it's also important to note that when we're talking about genetic risks, we have to understand that Alzheimer's disease, for the most part, is what we call sporadic. It means that if you have a family member with the disease, your chances of getting it do increase. But if you don't have a family member with the disease, it doesn't necessarily mean that you won't get the disease. It's sporadic. It can
Mm-hmm.
happen to anyone, uh, whether or not you have a family history. That's important to understand. Now, we have identified a couple of genes that if you have these genes, you will get Alzheimer's disease with
Mm-hmm.
100% certainty. But that's very rare. That maybe explains 1 to 2% of all the Alzheimer's disease cases. And that kind of Alzheimer's disease usually happens earlier in life, like in your 30s or your 40s. So there's no need to worry about those. Um, the For the most part, Alzheimer's disease is very sporadic, and it's late onset, so it happens at older ages. And that describes, for the most part, these non-modifiable risk factors. So age and genetic risks are two categories of risk factors that we can't do anything about. What's more
Mm-hmm.
important, however, is this next category, which is the modifiable risk factors. And now these are the risk factors that we can do something about. We
Mm-hmm.
can do something about these factors that could hopefully lower your risk of Alzheimer's disease and related dementia. So, for example, um, we know that we know that lifestyle factors like smoking, lack of exercise, poor diet, can increase your risk of dementia. And these risk factors are risk factors that you can do something about. Um, Also, related to that are risk factors that also affect the heart. For example, obesity. Obesity is another risk factor for dementia. Obesity can also
Mm-hmm.
affect your heart. And whenever we think about the heart, I always like to say whatever is good for the heart is also good for the brain. So what
Mm-hmm.
you want to think about is controlling your weight, uh, maintaining a healthy weight. Um, Also, diabetes. Diabetes is a risk factor for dementia. Um, if you do have diabetes, it's important to be able to manage your diabetes with medication. Um, Hypertension is another big risk factor for dementia. If you have high blood pressure, you want to make sure you lower it with medication to make sure that you also prevent or lower your risk of dementia. And these are important considerations as you get older, and of course these will also give you a better chance of having a healthier heart. And so those two things are related: the heart and the brain.
Mm-hmm.
And those are the risk factors that I generally like to focus in on, because these are the risk factors that we can communicate to populations and to communities that may not know that there is that link between the brain and the heart, and we need to
Mm-hmm.
make sure we engage in activity that can help to lower risks of disease for the heart and the brain.
Mm, absolutely. So to kind of summarize, there are the factors which cannot be changed, like genetics and age, but then there are these modifiable risk factors like lifestyle, health, disease control, like diabetes control. So there is a lot that one can do to kind of take a proactive approach to preventing. But you also shared that dementia is sporadic. So even if you were to do all the right things, that is not a 100% guarantee that you would not at some point begin to have some sort of cognitive decline. But also, like for example, I have the APO gene like 3-4, I think, so I have like a slightly increased risk for late onset Alzheimer's. That doesn't mean it's
Mhm.
a for sure written in stone thing that I will develop Alzheimer's, but it does. inform me that I need to take good care of myself now and be as healthy as possible. And
Absolutely,
that's
absolutely.
yeah.
Yeah, absolutely. And I often talk to folks who have ApoE genetic risk factors, and generally speaking, if you have this, as you said, it doesn't mean that you will get the disease. And in fact, by engaging in a healthier lifestyle, you can negate some of those higher risks that you would get from these non-modifiable risk factors. And that's always a good thing, because there you can have, at least with these lifestyle factors, you can have some control over your health, and be able to, at the very least, minimize your risk for
Mm.
developing dementia.
And that kind of segues into my next question. Is there a way to prevent dementia or Alzheimer's?
Yeah, that's a good question, and I usually say that there's no sure way to prevent dementia or Alzheimer's at the individual level, and and that's because, again, this is sporadic, so you don't know whether or not you will get it, but there are ways, as I said, to lower your risk and to stay physically active, to eat a healthy diet, keeping your mind engaged, maintaining your social connections, because we also have
Mm.
data to show that older adults that are engaged socially have a higher ability to protect themselves from dementia, and they're less
Mm.
likely to get dementia than those that don't have a lot of social connections.
Mm.
So that's important as you get older, to maintain these relationships, these connections to people, because that's going to
Mm.
help to give you a protection, against
Mm.
dementia.
Mm. Thanks for sharing that. I know you mentioned, as you were introducing yourself, that you've done a lot of work with more vulnerable populations that might be affected or disproportionately affected by dementia or Alzheimer's. How, if you could just speak a little to if there are other populations or which populations might be more at risk for developing dementia, yeah, that would be helpful.
Absolutely. So we know that the data clearly indicate that here in the United States, Black and Latino individuals are more likely to have dementia, and have a higher burden of dementia than those
Mm.
that are non-Hispanic white. And
Mm.
that doesn't necessarily mean that there's a specific susceptibility within these groups, but rather, as I mentioned, there are these risk factors that can increase the risk of dementia. And what we find is that Black and Latino individuals have a higher prevalence, higher numbers of higher proportions of being obese, of having heart
Mm.
disease, of having higher diabetes, um, unmanaged diabetes, higher rates of hypertension. And that is what contributes to the higher no, I wouldn't say susceptibility, but higher prevalence of dementia in these populations, and therefore a higher burden of dementia in these populations.
Mm. Mhm.
Another reason that explains it is also that a lot of I can speak for the Latino community. The I always we always talk about early stage diagnosis. We need to
Mm.
diagnose the disease early, so that you can make decisions about treatment and plan. But what we find is that in the Latino community, uh, it's usually late stage diagnosis, and
Mm.
we're not raising enough awareness of the disease, because it's stigmatized. A lot of it is stigmatized
Mm,
in our communities, and
mm,
people are not are resistant to getting checked out by
mm, mhm,
clinicians to get treatment for it, and to get diagnosed. So what often happens is that the diagnosis is made way too late when
mm,
the symptoms are very severe. So
mm,
there's a need to raise awareness in our communities and vulnerable communities about
mhm,
Alzheimer's disease and about getting diagnosed earlier, because I think that's what will hopefully change the trajectory of the prevalence that we're seeing here that is higher in these populations.
mm. It really sounds like there's an opportunity for more community outreach and education to
Absolutely.
folks who are people of color to let them know about symptoms and normalizing going to the doctor and really also for the healthcare system to provide culturally competent
Mhm.
services. Um, so yeah, I'm really glad that that has been an
Yeah.
area of focus for you because that's so important. You mentioned early stage, early signs of dementia. What are some of the early signs that folks could be looking out for?
Sure. So early signs of dementia can include memory loss. And when I talk about memory loss, I don't mean being for like occasionally forgetful, because we all forget things occasionally. We forget our keys, or we forget someone's name, or we forgot where we went on vacation maybe 5 years ago. So these kinds of things do happen, and forgetfulness does happen more often as we age. So that's normal aging. But the memory loss that I'm talking about here is usually new information that is newly learned information
Mm,
gets forgotten um, much easier. And what happens is
mm,
that whenever this happens more frequently, um, that could be an early symptom of dementia. If
mm,
this memory loss it happens to disrupt daily life, like if it continues to happen to the point where you're not able to drive a car because you're always forgetting your keys, then that becomes maybe an early symptom of the disease.
mm,
Um,
mhm,
if you have difficulty planning or solving problems, that could be an early sign. If you have trouble with familiar tasks that you would do on a daily basis before, and now you find yourself that you can't, that could be an early symptom. If you find
mm,
yourself being confused about time or place, you've been going to the beach every weekend for the past 5 years, but all of a sudden you have forgotten how to get there, or you're lost, or when you are there, you don't know where you are. You get lost in your
mm,
own home. These are symptoms, early symptoms of the disease.
mm,
Another one that I often talk about is are changes to mood and personality. So for someone
mm,
who's always been have had a happy demeanor, or is very bubbly, all of a sudden you find that person to be aggressive, or uncharacteristically aggressive
mm,
uh,
mhm,
for an extended amount of time. That is a clear symptom that needs to be assessed. And so if you
mm,
notice these signs in yourself, or a loved one, it's important to talk to a doctor when that happens.
mm, mhm. Absolutely. And I think a kind of a common question and one that I'm sure that you hear a lot is, if somebody is diagnosed with dementia or has dementia symptoms, are there any treatments?
That's a good question. So we have about 7 to 8 medications that are approved by the FDA to treat Alzheimer's disease. And many of these drugs, many of these treatments usually uh, take care of the symptoms of dementia. So some of the memory problems, the personality changes, they manage these symptoms, but they don't cure the disease. And only one or possibly two can slow the progression of the disease. But again, we're still in the early stages of understanding how this medicine works, and there's no the clinical benefit is still not known yet for sure.
Mm,
We definitely need more research into understanding how we can learn more about the disease, but also what are the drugs that we need to discover more drugs that can help not only to slow the disease, but hopefully one day to cure it.
mm. So I'm hearing that there are drugs to help symptom management, and there are very few, one or two, that can help with some of the slowing of the disease progression, but it's not curative.
It's definitely not curative, and we have a lot more work to do in the research space to discover new ways of treating the disease.
Mm. So with that, I'm curious to know more about UCI Mind and what it is and what it offers to the community.
Sure. So UCI Mind is a leading research institution focused on understanding the causes of Alzheimer's disease and related dementias. And our mission here is to advance treatment, to advance prevention, diagnosis, and also care for Alzheimer's disease and related disorders. And we do this through collaborative research and education. We at here at UCI Mind are one of 37 Alzheimer's disease research centers in the country that is congressionally designated to do this kind of work. And we're the only center here in Orange County that is designated as an Alzheimer's disease research center.
Mm,
And so we specialize in Alzheimer's disease and related disorders. We have about 60 faculty researchers across many different departments across campus, UCI. We come from many different departments, but we work collaboratively to tackle this disease in many different ways, from the bench to population science. We engage in research at all levels, from bench work,
mm,
animal models, all the way down to clinical trials and also public health, observational studies, longitudinal studies. We have a lot of research here at our institute. And so what do we offer the community? So we offer educational resources. We offer community outreach. We often go to communities. We give talks. We engage the communities with our disseminating our research and offering opportunities for people to participate in many of the research studies that we have ongoing. And our goal, again, is to really improve the lives of those affected by dementia.
mm. Thank you for sharing and for your work that you're doing. It's so important. And if there is somebody who wants to get connected with UCI Mind, how would they go about that?
Yeah, so to get connected, you can visit our website. We're at mind.uci.edu. And or you can attend one of our community events. You can sign up for our newsletter that you can find on our website. And if you're interested in participating in research, you can contact us directly to learn more about the studies that you might be eligible for. And we're here, to support you and support the community in any way that we can.
Thank you. Out of curiosity, what does it look like to participate in a research study, or do you have one off the top of your head that you could share a little bit about?
Well, sure. We we just closed one of our studies. It was a clinical trial for looking at an investigational medicine to treat, to prevent. It's a prevention trial to prevent symptoms from appearing down the road.
Mm,
So we were looking at an asymptomatic population with evidence of amyloid in the brain. And the idea there was to use an investigational medicine to remove the plaque from the brain and see if we can extend the onset of symptoms by a certain amount. Um,
mm,
that trial just recently closed for recruitment, but we have other trials, we have other studies. We have a longitudinal study where we're following people over time to look at the progression of Alzheimer's disease,
mm,
and closely examine what the risk factors are, what the disease process is like in different individuals, different from different backgrounds. So that longitudinal study is open and actively recruiting. We have if you're not looking for anything clinical, we have some other kinds of studies, some research studies like the consent to contact study, which is a registry of individuals that you can sign up for, and it's online. You can look us up. It's called Consent to Contact. You can put in your information there, and it's kind of like a dating app. If you find a study down the road that you might be eligible for, a researcher may contact you through that registry and have access to your information. If you're interested in participating, you guys connect to that study. And so that's open. That's always open for individuals who are interested in participating.
mm. Thank you for sharing that. Well, we're going to wrap up shortly, but is there anything that you would like to share with viewers, whether it's about dementia or UCI Mind?
Well, I'd like everyone watching to know that you're not alone. Whether you're concerned about your own memory or caring for a loved one with dementia, there are resources out there and there's support available. And it's always good to remember that research is making progress every day, and it's bringing us closer to better treatments and hopefully a cure, hopefully one day.
Mm, yeah. Thank you so much. Thank you,
Thank you.
Chris, for joining us and for sharing such important information. This has been really helpful. I've definitely learned more about dementia, and thank you for sharing about the UCI Mind program. For those in the audience that joined us, thank you, and we hope this information has been helpful to you. Our next webinar is going to be happening Monday, September 30th, and that's going to be at 3 o'clock. We will be discussing Medicare essentials and understanding Medicare basics with a special guest from the Council on Aging. So we hope you can join us. So thank you again, Dr. Salazar, and to all who joined us this afternoon. I hope you all have a great rest of your day and take care.
Take care. Thank you.